We are focusing on our Indian language services and the story dominating the world's headlines, the ferocious second wave of COVID-19 that is sweeping the country. The death toll has passed 200,000, although many believe the actual numbers are even higher. Lack of oxygen and hospital beds, overworked healthcare staff, and families not able to say their last goodbyes. These have become the normal for many. And amid the chaos and panic, the BBC's Indian language service journalists are on the ground and reporting for their audiences in Hindi, Gujarati, Marathi, Tamil, and Punjabi. So today we are hearing from some of them about the human stories of desperation and heartbreak at the eye of the pandemic storm and what it's like to be reporting on and living through this crisis. So first, let's start in Delhi and Piyush Nagpal, a video journalist with BBC Hindi.
I am a journalist. I keep watching news, different channels, different places, what's happening, what not. So I am always surrounded by corona news. We are eating news, we are drinking news, we are sleeping news, we are dreaming news. And when we are awake, we are again dreaming because we think, when will this end? When I stand in my balcony or on my roof, I can listen to only one sound, and that is ambulance. Ambulances running around, blazing through the streets of the city. Then when I go around for filming or when I go for a shoot, the things that I witness around is hysteria, complete breakdown of everything. I saw an SOS call on the doors of the hospital that we cannot accept more patients. Then I thought I could maybe talk to some patients who are admitted here or maybe their family members. I started asking them questions, and after a point I stopped asking questions. They just started talking and revealing their ordeal in whatever possible way they could. Running around, they were like begging for cylinders, arranging cylinders on phone, oxygen on phone. While they are arranging on phone, they are driving also. While they are arranging medicines, they are driving, they are walking, they are running all the time. They are thirsty, hungry. These are the family members of the patients. They are the most burdened because a COVID positive patient cannot arrange their own cylinder. When they're ill, when they should be given good treatment in the hospital, they are subject to horrible treatments, outside hospitals. Many of them dying outside hospitals, waiting for a bed, waiting for oxygen.
Oxygen mein le aunga. Oxygen mein le aunga, sarkar. Tum agar dawai dila sakte ho dila do, nahi to.
The man in the video,
koi tumhe Delhi mein vote, koi kisi ko nahi dega koi vote.
He's saying, who will give me oxygen? Who will provide me medicines? I will go get the oxygen, but can the government get me medicines? So he's folding his hands and begging for medicines, and he's saying, you should have supplied oxygen, but I'll go get the oxygen. Till then, please arrange medicines for my father.
Tombizolab, injection मिलेगा, remdesivir मिलेगा, कहाँ मिलेगा, कौन सी पुलिस की निगरानी में कौन से distributor मिलेगा, मुझे बताइए, मैं जाके लेता हूँ.
And in the later part of the video, he says that he has returned from a round of refilling the cylinder, and by the time he supplies the filled oxygen cylinder, he gets the empty one back, and then he goes back to get another cylinder filled. So that's his daily job. Drive around all day long, fill cylinders with oxygen. That should have been done by the government, or that should have been done by someone else, not the family member of the patient. That's what he's frustrated about. He is also saying that I will not vote for anyone in the upcoming elections. Any elections, I will not vote. Nobody in Delhi will vote. He's so angry. He has lost all his trust in the democratic system of this country. And on the other hand, Chief Minister of Uttar Pradesh says that there is a lot of oxygen, abundant oxygen in our state, whereas people are dying and gasping for breath. The state is absent here in India, basically. You call government offices, you call administration, hospitals, anywhere you can just try their numbers, they will be busy. Hospital beds are occupied completely. If you require critical health care, then you can already start saying goodbye to your family members. Basically, that's the scene. Everyone in India is facing the similar problem. Every second person I speak to is corona positive or their family members are positive and they are struggling for treatment. They're struggling for basic testing. But if I share my own personal experience, 3 days back I was running around carrying a COVID positive patient in my family. I was driving for him, and while I was driving, I was also making phone calls. I went to at least 3 hospitals in 2 days looking for a bed, and the person I was carrying, he is a lawyer, an influential lawyer in the city. He could not get a bed. Emergency ward, he could not get a bed, let alone special treatment. He was denied any treatment. And I am carrying him around in my car. I am not an ambulance driver. So basically, if I felt that, everyone else in the whole country felt that. People getting denied of treatment and of testing, of ICU, critical care, remdesivir injections, vaccination, everything is a big mess. I may sound a little angry, but that's how every other Indian sounds right now.
Piyush, Nagpal in Delhi. Next to the state of Gujarat, where on Thursday hospitals recorded their highest ever number of deaths in a single day. Let's hear from Ahmedabad.
My name is Roxy Gagdekar Chhara and I'm based in Gujarat in the western part of India. This state is the home state of our Prime Minister Narendra Modi. Gujarat has been victim of lack of awareness by the government and of course people at large, because Gujarat has seen 2 major events since the beginning of 2021. First of all, there were elections mainly in the rural part of the state. Elections were conducted in the last week of February and the results were declared in the first week of March. There were n numbers of political rallies conducted. Literally, people thought that there is no COVID existed in Gujarat. You can clearly see pictures where people were celebrating, people were gathering together, dancing and all that. We were out there reporting these gatherings and all. We tried to follow the norms, but it was impossible. That elections played very important role in the spread of the virus in this second wave, because in the first wave Gujarat witnessed only cases in the urban areas, but right now we are seeing large numbers of population in rural areas also been infected because of this political meetings and all that. The problem is that the health facilities and all are very limited in rural areas, so all that population has shifted to urban localities and the burden on urban hospitals has increased 4 times or 5 times. That is one reason of the second wave. Along with that, I would also say that 2020 cricket matches were conducted over here in the world's largest cricket stadium. The entire stadium with a capacity of over 100,000 people. It was packed jam. So the Narendra Modi Stadium's first match was full with people exactly during March when cases were on the rise.
Roxy Gagdekar Chhara તમારું સ્વાગત કરું છું. અત્યારે મારી પાછળ તમે જોઈ શકો છો, આ છે નરેન્દ્ર મોદી સ્ટેડિયમ.
So we were out during this cricket match also and we saw many people not wearing masks. Social distancing was a joke during that time. When you are out there in reporting and when you try to follow all the norms, when you wear mask and maintain a social distance and you ask the questions with people, that feeling is very weird when people see you as, what is he doing, why is he wearing mask?
मास्क पहन लो, पहले मास्क पहन लो.
I have told many people to wear masks during the live, but they don't listen to that and they say that, why are you so scared, because there were some days when 0 cases were reported in Gujarat in the month of January and February. So people started to think that, okay, COVID is gone and there is no need of sanitizers, there is no need of social distancing and there is no need of mask as well. That feeling is very weird. You are like an odd man out into that entire process. There were many people who came to see matches from the nearby states like Rajasthan or from Delhi or from Maharashtra or from Mumbai, where the cases right now are on rise. So I would say that cricket match and political gatherings and all that, they played a very important role in spreading the virus in the second wave in Gujarat.
Roxy, Gagdekar, Chhara. The worst hit state in India is Maharashtra, and it was also the site of a tragedy in a hospital last week. Here is BBC Marathi.
My name is Anagha Pathak and I work for BBC Marathi. I'm based in Maharashtra, that is the Western Indian state, and my hometown is Nashik, that is 180 kilometers away from Mumbai. Last week I was here covering an oxygen leak, and due to that oxygen leak, 24 people died. There was some fault in the central oxygen system and the oxygen was leaking for half an hour. So almost half an hour there was no oxygen, and like COVID patients were gasping for air, and it was scary just to imagine what those people must have gone through. They couldn't even breathe. They couldn't survive.
Hello and welcome to this Facebook Live. I am Anagha Pathak and I'm standing outside this Zakir Hussain Hospital in Nashik, where 22 Covid-19 patients have been confirmed they are died due to leakage of oxygen.
I was at the hospital. It was the back entrance of the hospital, and there were lots of ambulances and hearses carrying dead bodies.
If you can just see, there's this white...
It was a really sad scene at the time. I even while I was doing the live, I couldn't speak. I choked at a point because I saw a woman, she nearly fainted because she lost her husband. So yeah, COVID has hit India pretty bad, and I'm in Maharashtra, which is the worst heat state of the country.
Anagha Pathak in her hometown of Nashik, Maharashtra. BBC Hindi's Kirti Dubey is based in Delhi, but through a local reporter, she managed to compile a report about the harsh reality of families trying to arrange funerals for their loved ones in the Uttar Pradesh capital, Lucknow.
As the second wave unfolded, I did report on overflowing crematoriums across India and how people have to wait outside with corpses of their relatives. And I spoke with a man in the city of Lucknow who lost his younger brother. He tells me that he was running for beds, one hospital to another, because his brother's oxygen level was really low. And after spending 2 days searching for hospital, he couldn't find and he couldn't save his brother. And the misery is, after even dying, he had to wait for 12 hours outside the crematorium to cremate his brother. He said that I couldn't mourn for my brother because I'm collecting votes, filing papers, to completing formalities, and instead of crying for my little brother who was younger than me, I'm actually waiting for this queue to end and just to cremate, because it's been long. I have spent 2.5 days searching for bed and now waiting outside just to cremate my brother. His wording actually stuck to me, that first a person has to struggle for oxygen, for bed, for treatment, and even after death, a dead have to wait outside the crematorium. I mean, if apocalypse has a face, it's Indian crematorium and hospitals right now.
Kirti Dubey. We also asked our colleagues if there was a person, a report, or even an image that summed up the whole tragedy for them. Here is Roxy again in Gujarat.
When I was going through some newspapers, I saw an image in a local newspaper wherein there were 3 elements in that picture. There was a dead body of a woman who was sitting on a wheelchair, and there were 3 ambulances kept right near that wheelchair, and there was an oxygen tank, huge oxygen tank in front of that wheelchair, and there was also a stretcher near that wheelchair. That lady died because she was not able to get ambulance. If she would have got the ambulance, she might be able to get oxygen. Because she was not able to get ambulance and oxygen, she died right in front of both oxygen and ambulance, and that picture has actually broken my heart. I mean, that picture describes today's present situation of Gujarat. People are dying right now outside hospitals. They are not getting any help. There are no ambulances. There is no oxygen. There are no medicines. So that is the image, I think, that will remain with me forever.
Roxy, Gagdekar, Chhara of BBC Gujarati. And for BBC Marathi's Anagha Pathak, the COVID pandemic hit very close to home.
This COVID-19 is not just a story for me. It also hits a personal note because I also lost my aunt due to COVID. And it was, how should I put it? It was really sad and scary at the same time, because when we got the news that she is no more and the hospital released her body, I asked my father there who will be there, and he had no answer, because you know what COVID does to you? It kills you and it makes you lonely in the end. And not just the person who has died is lonely, the person who has survived is also lonely. I'm a Hindu, and in my community, women usually don't go to crematorium. But I told my father that, I'll come. And he didn't hesitate, because someone should be there. We were just 4 people there. It was me, my father, my another uncle, and someone from my aunt's maiden family. That was the first time I entered a crematorium in a family surrounding. And no one even blinked an eye, because nobody had time to think about it. So I was there in the crematorium, and I climbed up to the platform, and there were 8 pyres burning at the same time. And it's scary to even tell you that I couldn't even recognize where my aunt's pyre was. I didn't know. My father pointed out to one pyre and said, that's Mita, that's my aunt's name, that's her. And I was standing there in the middle of 8 pyres, and the heat was coming to my body. I could feel the heat. It was hot everywhere. I was wearing 2 masks and a face shield, and I was all sweaty. My face was all wet, and I couldn't tell the difference, that whether it was sweat or tears. No one was there. Not her husband, not her kids, not her family, not my mother, not her family, like her maiden family. And I wanted to cry. But I couldn't even, find someone's shoulder to cry on. And I am sure this must have happened to everyone. Imagine her husband, my uncle, who was lying on a bed in a hospital all alone. His wife had died, and, he couldn't do the last rituals of her. And imagine the guilt that he must be having, and imagine the guilt that he will take to his last breath, that I couldn't do even the last rites for my wife. It's so lonely. It's so lonely for the people who are dying, and it's so lonely for the people who are even surviving, that you can't even cry on someone's shoulder. You can't do the last rites properly. You can't even talk to the other person, and share your grief. That's what COVID is for me, my family, and I'm sure that must be COVID for so many families. Every 3-4 minutes, one hearse, one ambulance arrives with a body in it. 3-4 people come, and everything ends in like 5 to 10 minutes. Usually, if you see such kind of Indian family, there will be at least 50 people, minimum 50 people in the crematorium, and hundreds of people back home. No one is there right now. It's all alone. It's just the burning pyres, people who are working in the crematorium, and one person who is there to just finish the job. It's not last rite. It's just finishing the job. And it's really scary and sad for me and all the people out there.
Anagha Pathak sharing with us her own family story. Let's end with Jugal Purohit in Delhi, who oversees Indian language's TV output, but just as importantly, the journalists themselves who continue to report while dealing with their own fears and tragedies.
Last 10 days, it has been a constant stream. At some point, you feel like you don't want to maybe look at social media, and you can switch off. What was tough was when your own personal messaging apps are full of those very people who you would talk to, who you would possibly share a joke with, seeking help. In Delhi, Weekend is tracking anonymous leads, seeing posts on social media about some oxygen being available somewhere, some medicines being available somewhere, and then calling people up. Most of the times, 99.9%, you draw a blank. You keep on drawing a blank. And then those victories, if I can even call them, are victories where you would possibly be somehow successful in getting an oxygen cylinder refilled for a colleague who was gasping for breath. Or maybe you managed to perhaps get a test done for another colleague who was not well. It's kind of come down to that. I work as a senior producer, overseeing the operations of 5 different languages. And all of these teams are built of people who've come to Delhi from different parts of the country. They do not have their roots here. They do not have their families here. And what the last 3 weeks have done is that they've cemented our relationships with each other, and we've become their families. We're there for each other. A lot of my colleagues, a lot of our producers have not surprisingly fallen ill, and to be extremely sick and stranded in a region where possibly you can't even speak the language is extremely, extremely distressing. And we've encountered so many such cases with our colleagues. I'm very proud that we've cast this very strong net of safety around them to make sure that we can do whatever is in our hands to somehow help them. And it has worked on most occasions. But it has been extremely distressing. This whole experience has told us that we may be divided by languages and cultures, how we dress and how we eat, the food we eat. But I think we are united by humanity. We are united by values of friendship, of camaraderie, of professionalism, and that has been extremely heartening. But it has come at a huge cost. And I hope those who are listening can appreciate the amount of efforts that are being undertaken so they get the right news, they get the right picture, because it's what drives us each day.
Jugal Purohit in Delhi. And our thanks also to Piyush Nagpal, Roxy Gagdekar Chhara, Kirti Dubey and Anagha.